Hi everyone. Today we are celebrating World Diabetes Day 2021. As a part of World Diabetes Day, we, the students of 2nd BSc Zoology Model 2, St. Xavier's College for Women, Alva, are here to present a video on diabetes, the types of diabetes, the symptoms, complications and causes etc. of diabetes, and the medications of diabetes, and in the present scenario of COVID-19, how diabetes is linked. So let's see all these in our presentation. So let's move on. What is diabetes? One of the most commonly found medical condition, that is diabetes. Nearly half of the total world population is suffering from this medical condition. Diabetes mellitus is a disorder in which the body either does not produce sufficient insulin or respond normally to insulin, which causes abnormal increase in blood sugar level. This abnormal increase in blood sugar level, termed as hyperglycemia, occurs mainly develop if the diabetes is not treated properly. Hypoglycemia sets in. Just the opposite of hyperglycemia is the hypoglycemia, is when the blood sugar levels are too low. This is usually the side effect of treatment of blood sugar lowering medication. Let's see, when is blood sugar considered to be too high or too low? Slight fluctuation in blood sugar levels are completely normal and also happens on a daily basis in people who do not even have diabetes. Between around 60 and 140 milligram of sugar per deciliter of blood is considered to be healthy. This is equivalent to blood sugar concentration between 3.3 and 7.8 millimole per liter. Millimole per liter is the international unit for measuring blood sugar. It indicates the concentration of a certain substance per liter. If type 1 diabetes is left untreated, people's blood sugar levels can get very high, sometimes exceeding 27.8 millimole per liter, that is 500 milligram per deciliter. Blood sugar concentration below 3.3 millimole per liter, that is 60 milligram per deciliter, are considered to be too low, that is hypoglycemia. That is the value of hypoglycemia, when the blood sugar falls too low, that is below 60 milligram per deciliter. Coming to the world status of diabetes, approximately 463 million adults ranging from 20 to 79 years were living with diabetes in 2019. By 2045, this will rise to 700 million. The proportion of people with type 2 diabetes is increasing in most of the countries. 79% of adults with diabetes were living in low and middle income countries. As per the diabetes rates of country in 2021, China has the highest number of diabetes cases worldwide, around 116 million people affected. Followed by India in the second position, around 77 million people affected, and US in the third position with 31 million people affected with diabetes. This is a graph depicting the global prevalence of diabetes increased from 211.2 million in 1990 to 476 million in 2017, with the 129.7% increase. Here the grey bar represents the total in each year, and the red one indicates the female and the blue male. Coming to the theme, access to diabetes care. World Diabetes Day, 14th November 2021. Is the birthday of Sir Frederick Banting, the scientist who, along with Charles Best, who discovered insulin. That's the main reason why 14th November is celebrated as the World Diabetes Day. So in this presentation, on behalf of World Diabetes Day, we will look forward in three major types of diabetes, that is type 1 diabetes, type 2 diabetes and gestational diabetes. The number of people with diabetes rose from 108 million in 1980 to 422 million in 2014. In 2019, a total of 463 million people are estimated to be living with diabetes, representing 9.3% of global adult population. In 2019, diabetes was the 9th leading cause of death, with an estimated 1.5 million deaths directly caused by diabetes. Diabetes is the third major contributor to non-communicable disease and overall mortality in India. Along with the experience of millions of people in limelight about how they overcame this condition, as well as the genetic engineering of production of artificial insulin, which is used by many people in the contemporary world. So let us move on. Type 1 diabetes. It is also known as juvenile diabetes or insulin-dependent diabetes. It is a chronic situation in which pancreas secrete little or no insulin. Different factors of genetic and some other viruses also contribute to the type 1 diabetes. The exact causes of type 1 is unknown. The body's own immune system, which normally fight harmful bacteria and viruses, destroys the insulin producing cells in pancreas and other causes diabetes and also include genetical causes, and other environmental factors are also involved. Certain symptoms of type 1 diabetes include increased thirst, extreme hunger, unintended weight loss, bedwetting in children, fatigue and weakness, blurred vision, irritability, mood changes, etc. Some complications are really life-threatening, which includes heart and blood vessel diseases, neuropathy, nephropathy, eye damage, pregnancy complications, etc. Coming to the prevention, still now there is no known way to prevent type 1 diabetes. Scientists are still working on it. Moving on to type 2 diabetes. Type 2 diabetes is the most common type of disease that occurs when the blood glucose is very high. In this condition, the body doesn't make sufficient insulin or does not use insulin well for proper functioning. Type 2 diabetes can develop at any age and even during childhood. Most often, it is seen among the middle-aged or the elder people, that is old-aged people. Symptoms include increased hunger, thirst, blurred vision, weight loss, tiredness, frequent urination, wounds that do not heal, heart disease. And the causes are mainly by lifestyle factors, obesity and lack of exercise, genetical or abnormal genes are also involved. Complications include it affects major organs like heart, nerves, blood vessels, kidneys and eyes, skin conditions, slow healing, hearing impairments, sleep apnea, dementia. Controlling the blood sugar can lower these risk factors. Now coming to prevention, a healthy lifestyle can help to prevent diabetes. These healthy lifestyles includes eating healthy foods, avoiding inactivity for longer periods, losing weight, getting active, quit smoking. Now let's see what is gestational diabetes. Gestational diabetes is a high blood sugar that starts or is first diagnosed during pregnancy. Pregnancy hormones can block insulin from allowing glucose to enter body cells to provide energy. When this happens, glucose levels may increase in a pregnant woman's blood. Symptoms include increased thirst or sharpness, blurred vision, fatigue, infections in the vagina, skin or bladder, increased urination, all these. And treatment, coming to the treatment, treatment strategies include daily blood sugar monitoring, a healthy diet, exercise and monitoring the baby. If blood sugar is too high, medication is required. And how can we self-care, how can we take care of ourselves? Like healthy self-care is possible by healthy diet, diabetic diet and physical exercise. Medications also include healthy diet, diabetic diet, physical exercise, anti-diabetic medication and insulin. Now let's see how insulin was discovered and its early usage. Insulin was discovered by Sir Frederick Banting and Charles Best and J.J.R. MacLeod in 1921. It was a big milestone in the field of medicine. However, as a remedy in all the three types of diabetes, the commonly adopted one, even in case of the patient who is incapable of producing insufficient insulin or showing autoimmune reaction, or for diabetes in pregnancy, it is the injection of external insulin. During the early period of administrating the insulin, pig insulin was used as being similar to human insulin. Was pig insulin administration accepted? Let's see. Even though with most similarity there was a small change in the structure of insulin as it differed from human insulin by an amino acid. Extensive use of bovine and porcine insulin resulted in triggering allergic reaction in patients, and further the production of porcine insulin was discontinued. To cope up with this problem, genetic engineering came to help, and at the present world we are using human insulin which is artificially produced in large scale. This was done by Eli Lilly company. Production of insulin by Eli Lilly company. That's what we are going to see in the upcoming slides. Eli Lilly was one of the first pharmaceutical companies to produce human insulin. The production of insulin by rDNA technique was achieved in 1983. The steps involved in the production of genetically engineered insulin are the following. Step 1. Isolation of insulin genes from human cells. Step 2. Introduction of these genes into the plasmid of E. coli. Step 3. Cloning of genetically engineered E. coli. Fourth step. E. coli cells are introduced in a bioreactor. Step 5. Chain A and B are produced separately. And the final step, these insulin chains are combined by disulfide bonds to form human insulin. Eli Lilly and Company is one of the world's largest pharmaceutical companies responsible for mass production of insulin. In 1923, Lilly began selling Ilatin, their trade name for the first commercially available insulin product in the US for the treatment of diabetes. Frederick G. Banting MacLeod won Nobel Prize in 1923 for their research. Eli Lilly enjoyed effective monopoly on the sales of insulin in the US for almost 2 years. The success of insulin enabled the company to attract well-respected scientists, and by its 50th anniversary in 1926, sales reached $9 million. Now moving on to a very interesting topic, diabetes and drugs. Diabetes is now a major epidemic and 425 million people are living with diabetes. Various drugs are used to treat diabetes, and most interesting part is to know that BIOTECH is standing up to the disease. BIOTECH is working on it to find a way to stop its track. Let us take a look on various drugs and treatments used for treating diabetes. First one is insulin. Insulin is the most common medication used for the treatment of type 1 diabetes. Types of insulin include long and rapid acting. Amylinomimetic drug. That is the pramlintide simlin-pen 120, simlin-pen 60 is an amylinomimetic drug. This is an injectable drug used before meals, also used for treating type 1 diabetes. Medications for the type 2 diabetes are oral medications mostly. Metformin is generally the first medication. Alpha glucosidase inhibitors. These medications help your body break down starchy food and table sugar. Now coming to metformin, that is biguanide class. Metformin is included in the biguanide class. It is considered as the first line oral agent for patients with diabetes and can be used to treat prediabetes. And the next medication for type 2 diabetes is Victoza. It works by decreasing glucose insulin secretion and slowing gastric emptying. Never ever take these medicines without consultation of a doctor, and also the prescribed dose is very much essential. Coming to BIOTECH and diabetes. BIOTECH is working hard to find a cure for diabetes, and they introduce various treatments and medications. For example, cell therapy, which has the potential to replace the cells damaged by type 1 diabetes, is one of the biggest hope towards the cure for diabetes, replacing missing insulin cells. Humulin. Humulin is human insulin used for the treatment of diabetes, developed by GeneTech, the first American biotechnology company. Humulin was licensed to Eli Lilly, and it became first marketable product created through recombinant DNA technology. Now let's see how COVID and diabetes is interlinked. People with diabetes appear to be more vulnerable to becoming severely ill with the COVID-19 virus. When people with diabetes develop a viral infection, it can be difficult to treat because of the fluctuations in blood glucose level and may lead to several diabetes complications. Viral infections can also increase inflammation in diabetic patients. People suffering from type 2 diabetes are at increased risk of severe illness from COVID-19. There is no evidence whether COVID-19 would contribute to diabetes. Now, as a conclusion, we can say that diabetes is a slow killer. It is important to keep the blood glucose levels of patients under control to avoid the complications. Diabetic patients are most likely to have severe symptoms and complications when infected with any virus, and it takes time to recover from any kind of diseases for these patients. Based on Center for Disease Control report, people of any age with certain underlying medical conditions, including type 2 diabetes, are at increased risk of severe illness from COVID-19. These are the several challenges in the successful treatment of diabetes mellitus because of personal and economic cost incurred in diabetes therapy. As a famous saying goes, prevention is always better than cure. Thank you. Thank you for your patient listening.